A White House team is coordinating efforts to combine public and private resources in response to the coronavirus. One America's Hans Hubbard has more.
A combined team of public and private sector experts is spearheading efforts at maximizing America's resources during the pandemic. In early March, President Trump tapped senior White House advisor Jared Kushner to coordinate efforts between the government and the private sector in the fight against COVID-19. Kushner formed a team composed of both private sector experts and government officials. Among those in leading roles figure Innovation Chief at Medicare Brad Smith, U.S. foreign investment expert Adam Boehler, and Nat Turner of Flatiron Health.
The president wanted to make sure that we had the best people doing the best jobs and making sure that we had the right people focused on all the things that needed to happen to make sure that we can deliver in these unusual times for the American people. The president also instructed me to make sure that I break down every barrier needed to make sure that the teams can succeed.
The team's first task was to ramp up testing in the U.S., an effort in which cooperation with the private sector, including setting up testing sites at Walmart locations, has reportedly yielded significant results already. On the day the team was formed, the U.S. was performing 5,000 tests a day. Last Friday, that number had risen to 300,000. Kushner's team was also tasked with revamping federal supply lines, particularly with regard to ventilators, to maximize the use of existing supplies and use the federal stockpile as a complement to state resources.
The first issue that we've been dealing with was really the ventilators. That was the number 1, number 2, and number 3 from all the states. What we've been finding is that people have a lot of these requests based on the models, and what we've been trying to do over at FEMA is say to the states, well, if you would like ventilators, we need to see first look in your states.
This approach, which relies on up-to-date, real-time knowledge of supply numbers and usage rates, has reportedly vastly streamlined supply lines and minimized waste. According to Kushner, it is centered around the concept of good management, making decisions based on actual needs rather than uncertain projections, and increasing the mobility of resources as the needs of different areas shift day by day.
Everyone's asking for everything. One congressman got a call from his local hospital saying, I need 250 ventilators. And he said, well, you don't have a COVID patient within 4 counties. Why do you want 250 ventilators? And he says, well, we just want to be safe. We're very nervous right now. So what you have all over the country is a lot of people are asking for things that they don't necessarily need at the moment. And the job of FEMA and Admiral Plavchek has been to try to make sure that we're getting the real data from the cities, from the states, that we can make real-time allocation decisions based on the data.
Democrats have criticized both Kushner's involvement and the inclusion of the private sector, though at least one analyst has rebuked this, saying, quote, I don't remember any Democrats say it's terrible. The private sector is helping save Obamacare. And as the team's efforts continue, its next test will come this month as states begin the process of reopening the economy, a process predicated on increased generalized testing. The White House projects, in part thanks to the Kushner team's efforts, that the U.S. will carry out 8 million tests in May, more than the total number conducted in the last 4 months combined. Hans Hubbard, One America News.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube. And call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.